First one is tonic seizures. In tonic seizures, what will happen? See, just imagine this is the patient's body. मान लो patient is doing some activities. Patient कुछ चलते जा रहा है, doing some activities. Suddenly, in tonic seizures, suddenly patients, all the muscles will be contracted. Stiff हो जाते muscles पूरे. Total muscles will be stiffed. Muscles stiff हो जाते. And what happens? Patient will fall backwards. नीचे पीछे की तरफ गिर जाता. Patient will fall backwards. This type of seizure is called tonic seizures. याद रख लो, these type of seizures are mainly based on their type of origin and how they are showing symptoms in the patient. Okay, so if suddenly patients all the tissues are contracted, stiffness occurs, and if patient falls backwards, that type of seizure is called tonic seizures. Clear? Now second type, I will try to show you the image here. I think you understood what is generalized seizure, focal seizure. Okay, in generalized seizure, yes, in generalized seizure, the first one what we have seen tonic phase or tonic seizure bolte isko. Tonic seizure, what happens? See, patient will fall like this. Total tissues are contracted, pura stiff ho jate tissues, and patient will fall backwards. Okay, like this. This is called tonic seizure. Next, in generalized seizure, we have clonic seizure. Or in clonic seizure, what happens? See, when patient falls backwards due to tonic seizure, immediately patient will have severe contractions. This type of contraction, severe legs and hands movement, भड़बड़ मार लेते रहता patient. Severe contraction and relaxation, movement of the hands and limbs will be seen. That is called clonic type of seizures. And see, if tonic seizure starts to the patient, and immediately after tonic phase patient develops clonic, that type of seizure with tonic and clonic, that type of seizure is called tonic-clonic seizure. Initially patient was having stiffness, patient has fallen down, and immediately patient started developing the movements, hand and limb movements. That is clonic phase. First tonic phase होगा, उसके बाद clonic phase होगा. Clonic convulsion alone can be seen. Tonic convulsion alone can be seen. Tonic alone हो सकता है, clonic alone हो सकता है. If patient has tonic and clonic together, that is called tonic-clonic seizure. Okay, just to understand, I have provided these images. I think you all are following me. Okay, first tonic seizure we have seen, next clonic seizure we have seen, and then tonic-clonic seizure we have seen. Okay, and another seizure we have, which is called I'm sorry, atonic seizure. Atonic seizure. See, in atonic seizure, what happens? Immediately patient will have relaxation of the muscles. Muscles पूरी relax हो जाते हैं. हाथ में कुछ phone, cell phone, bottle, water कुछ भी पकड़ते रहते हैं ना, that immediately patient's all muscles will be relaxed, and immediately patient will fall front side. This is called atonic seizure. याद रख लो. In previous tonic seizure, what we have seen? In tonic seizure, patient's total tissues were contracted and patient has fallen backwards. And here in tonic, this is atonic. Atonic means here no convulsions. In atonic seizures, all the muscles will be relaxed and patient will fall front side. दांत वांत पूरे तोड़ लेता ऐसा गिर के. Okay, this type of seizure is called atonic seizure. Based on their signs and symptoms and based on their type of convulsion, we have different types of seizures. I think you all are following me. Okay, atonic seizure also finished. Now next is, see, this type of seizures are myoclonic seizure. These are very, very common type of seizures. Myoclonic seizures, whenever you go to pediatric department, especially in small age children, if patient had some malnutrition or due to abnormal development of brain or due to meningitis, whatever, there are so many causes. I'll explain those causes also. Patients, all the tissues, especially limbs will have severe contraction and relaxation. That type of seizures is called myoclonic seizures. Myoclonic. All muscles will be moving rapidly, jerking movements होते रहता है patient को. Here patient may be on the standing position or patient may be in the sleeping position, falling down, जो भी कुछ भी है. Here this type of seizures are called myoclonic seizures. This is the fifth type of seizures. Okay, and the next one, the sixth type of seizure is absence type. Absence type of seizures. Absent type of seizures is that seizure. See, this is mainly characterized by sudden, sudden stoppage of sudden stoppage of consciousness. यहाँ पे क्या होता, patient will be reading something, patient will be doing some activity. Suddenly what happens, patient का consciousness चले जाता, and patient will be looking somewhere. टीचर बुलाते रहते, फ्रेंड्स बुलाते रहते, पेशेंट्स को ध्यान नहीं रहता वहाँ पे. This type of seizure is called absence seizure. Sometimes what happen, patient will be walking on the road. Patient stops. Suddenly patient will stop, and patient will lose the consciousness. Patient को पता नहीं चलता where patient is going. Okay, so this type of seizures are called absence type of seizures. In these seizures, patient will not have any convulsion. Okay, seizure रहता है here, but convulsions are not seen in this case. So this type of seizures are called absence type. This is the sixth type. And finally, the last one is seventh type of seizure is status epilepticus. This status epilepticus can be seen both in focal seizures और इन जनरलाइज्ड सीजर्स. बोथ फोकल सीजर में भी हो सकता है, जनरलाइज सीजर में भी हो सकता है. स्टेटस एपिलेप्टिकस इज नथिंग बट द पेशेंट विल हैव कन्वर्जन, एंड दिस कन्वर्जन विल स्टे मोर देन 5 minutes. If patient has convulsions continuously more than 5 minutes, this condition is considered as emergency condition, and this emergency condition with convulsion is also named as status epilepticus. Immediately patient should be started with pharmacotherapy. Here actually in status epilepticus we will go with lorazepam. याद रख लो, lorazepam injections. Lorazepam is having rapid acting. It is having rapid acting as well as short duration of action. Immediately it will stop the convulsions of the patient. And we also have other drug of choice, but most commonly lorazepam is commonly given in our hospitals. So this is one type of convulsion. Okay, now you see, I will try to explain you the